Okay, sir. Shall we start?
Yes, sir, definitely. Please, we can go ahead.
Yeah. Welcome you all for the evening webinar. And JOCR, the Journal of Ophthalmic Clinics and Research, is the official journal of the Andhra Pradesh Ophthalmic Society. And we are conducting a series of webinars on research methodology. And this is the third one we are doing it. And so many basic aspects have been covered. And today also, we're going to cover some of the basic aspects in some of the tips in writing the articles and all. And the basic intention is to see the postgraduates get a few tips in writing easily and approach where to go and from where he has to start, right from the research question to the final conclusion and the references. So that's what our main intention is. And not that going for a very high five, but one of the basic aspects is covering very nicely. And Bharatji is covering very nice. And now I request Sudhira to introduce Bharatji. Sudhira? Hello? Are you there?
Sir,
yeah, please introduce Bharatji.
Good everyone. Good evening to all the JOCR. Am I audible?
Yeah, you are audible.
AFMC Pune, and it is Am I audible, sir? No?
Yes, you can go ahead.
Dr. Bharat did his DNB from he did his undergrad for cataract, cornea, trauma, and refractive services at Gombay Nethralaya, Nimang. His keen interest is in research and publication. He published more than 340 peer-reviewed articles in various national and international journals and reviewed more than 500 papers for various journals. His keen interest is in microbial keratitis, keratoconus, dry eye, ocular trauma, and proficiency, and is proficient in lamellar surgeries. He has more than 50 awards, national and international, and presented 2020 and 2021 and 2022, and also in 2023, all 4 consecutive years. IJO Award for maximum citations for original articles.
I think there's some problem with regard to connectivity. Gopal, you are online?
Yeah.
Yeah, you can say a few words about the webinars, what is the intention of that, and then we will go on to the next one. You can say the intention of why we are doing it.
Yeah, I think I should congratulate K.N. Murthy and his team.
Sudhir, thank you very much. You have done a good job. Only thing is some problem with the connection, so let the Gopal will speak about a few words.
We should not get disturbed by the number of participants online today. Subsequently, many people will be accessing in our channel. So another important thing is it is like a permanent source in our website, so that subsequent fresh graduates or anyone who is interested in the research methodology and then the publication can access these webinars, and then they can get it. It is a wonderful job, and mainly we should be thankful to Bharat and his wife for sparing their time and then contributing. So we complete today with this. We will have a complete spectrum of the right from the basics to the final publication of the research methodology and the publication. I think with this, we'll hand over to Murthy sir to carry forward the reading. Murthy, please go ahead.
Yeah, thank you, sir. Sanjay madam, are you online?
I would like Dr. Bharat to continue with today's topic. Please start, sir.
Sure, ma'am. I'll share my screen, ma'am.
Yeah, please go ahead, Bharat. Please, I welcome you for the third module of the webinar, and I want to hear from the Bharat how he's going to enlighten us. Go ahead.
Sir, I'm not. Yeah, sir. Just a minute.
Yeah, we're able to see and make it to the.
Just a minute.
Yeah.
Just a minute, sir. My screen. I'm audible, sir.
You are audible. You can go ahead.
So first of all, I'll at the outset I'll like to thank Andhra Pradesh Ophthalmic Society and Dr. K.N. Murthy sir, Rajagopalu sir, and Madhu sir for giving me this opportunity to share my thoughts. So as we had already concluded previous two webinars sharing thoughts on research and publication, today's topic is successful researcher in publishing his or her work. So I'll be sharing my thoughts, whatever best I can. Describe about my what about this topic, as well as whatever has been my experience for the past 5 6 years which I have been publishing. So just a minute, sir. This yeah. So first of all, the first before we begin article, as we begin article, always the focus is in abstract, like how to write an abstract. So there are two kind of people. First, who will write the whole paper and they'll come to the abstract in the end. Some people are like they'll follow the abstract first because they want a concise summary of the article. So they'll have a mind like I'll write abstract like this and then I'll go for the paper. I'm usually kind of a person who will usually come to the abstract in the end. So if you just a minute, yeah. So in an abstract, you should always start with a clear objective, like summarize the purpose of your whatever the purpose. Basically, a paper is includes an introduction, methodology, results, and conclusion. Basically, you have to summarize the four things in a word limit of maybe 250 to 300 word, and how you can best do it. Like first, you have to just give the purpose of a paper, or what is the target, or what is the focus, like clearly state the research question or the hypothesis being addressed. For example, the aim of the study was to evaluate the AI based detection algorithm in uveitis diagnosis. So always is like that. Before that, you can always mention a line on the topic, like what is AI, what is the role of AI in uveitis, for that, and then you can begin with a clear objective. And then you can go for describing the methods, like provide a concise overview how the study was conducted, the key methodology, the setting, the duration period, time period, the instruments used. For example, we conducted a retrospective analysis of 200 cases using OCT imaging and AI algorithm. So basically, first couple of lines will give you, you have to summarize the objective of the study. Next couple of second line, 2 lines or 3 lines for the methodology. Then you have to highlight the key findings, maybe the results, focus on the most significant result without going into excessive detail. You don't have to mention everything because you have to stick to the word limit, and you have to highlight the main point so that whosoever reads, because nobody has time to spare to read whole paper of yours, they will mostly go through the abstract. An abstract should be always eye catching. So you have to mention the most important finding or the results of your study. For example, This AI model demonstrated 85% accuracy in detecting inflammatory markers compared to clinical grading. So this should be like, what is the gist of your study, or what is the focus of your study, that you have to mention in the results. And conclusion, it ends with a statement on the relevance and implication of findings for the field. For example, the study underscored the potential of AI in streamlining diagnostic processes for uveitis. The main thing is, the important thing about conclusion is that it should not be a hypothetical conclusion, or it should not be a conclusion which is generalized. It should come out from your study. So that has to be kept in mind, that you can't mention anything like that the conclusion was that or something. So the conclusion has to come out from your study, and that should be sound and should be robust. Then coming to the next thing is clarity and conciseness. You have to adhere to the word limit and ensure that the abstract communicate clear information succinctly and clearly, avoiding unnecessary detail. Example, most abstracts are limited to 50 to 300 words to ensure clarity and focus. The spellings has to be correct. There should be no short forms, and everything has to be mentioned clearly. So this is the important thing is the first impression. The abstract is the first impression of paper. The abstract is often the first part of the paper that readers see. A well-written, concise abstract can captivate and inform the audience. For example, a compelling abstract increases the likelihood of the study being read and cited. That's very important. Some abstracts are so nicely written that people just go through the abstract and they will quote the papers with just reading the abstract. So then there is no need to go into the whole detail of the paper. Journal requirement. Many journal and conferences enforce strict word limit for abstract to maintain consistency and ease of review. So always check the guidelines. You have to check the guidelines. Some journals. So another thing about an abstract is a structured abstract and a non-structured abstract. A non-structured abstract is like it doesn't have any subheadings. A structured abstract has a heading. Like for example, a purpose. Then comes the purpose. Then comes the methodology. Then comes the results and a conclusion. For example, if you go to European journal and write a case report, there is you have to mention in what is the purpose, then you have to mention the case description and the conclusion. There are only three subheadings. So every journal has different requirement, different guidelines. So a structured abstract is usually required for a paper. A non-structured abstract usually required for a review article, like that. And then focus on the key aspects, like keeping within the word limit forces author to prioritize the most critical aspect of research. For example, eliminating extraneous information allow audience to quickly grasp the study signal. That's very important. The importance of word limit is that you should not, the authors are forced to give the most important meaning out of that abstract study. For example, like this is a recent study we published. So now this is a structured abstract: purpose, methods, results, and conclusion. So you see now the purpose just gives the two-line purpose, like what was the main purpose of the study: to study the visual outcomes and complications of cataract surgery. Then methodology, like you have to mention the which all patients were assessed, and what was the duration, and how the patients were assessed, like retrospectively. And then what was assessed, like demographics, visual acuity, entry postage segment details, like that. And what were the techniques which we were compared, like FACO and MSICS. And then results. So that another important part is, whatever has been written in method should not be repeated in the results. Nothing should go repetition. And then you have to mention the key important aspects of the results and the conclusion. So you have to strictly adhere to the word limit, and then it looks, so if you read this abstract, it looks good, like something nicely communicated in a short form. Then coming on to the title, like how to write the title. So important thing about a title is conciseness. Keep the title short and to the point, ideally under 15 words. Most of the journals or wherever, for example, you're submitting a paper, the word limit for a title is 15 words. A concise title is easier to understand and grabs the reader's attention quickly, especially when scrolling through the search results or journal list. And sometimes you have to put some catchy words or some new words, or maybe, for example, I'll just give you an example of word innovation. If you put innovation, everyone thinks what innovation. So some people will always try to go through that article or abstract if something is written like that. It should be descriptive. The title should accurately describe the researcher's main topic and scope, giving readers an immediate idea of what the paper is about. Avoid vague terms and to focus the study essence. Unnecessary things should not be written. I'll just give you examples now. Specific keywords. Incorporate relevant keywords that are commonly used in the field of study. So the important keywords of ophthalmology should be included. For example, dry eye syndrome, keratoconjunctivitis sicca. So these are classical words which are ophthalmology literature based. This improves the title searchability in database and ensure that your search research reaches the right audience. And avoid jargons. Don't use any language. Like I'll just give you a recent example. I just saw in IGO there was a 4 or 5 line title. This was title was around 5 lines, so that is not accepted. You cannot write a title of 5 lines that is having around maybe 50 words. So that is like that gives you like the whole purpose of the study has been written in the title. That should not be done. Okay, so use language that is accessible to a broad audience, avoiding overlay technical terms unless they are necessary. They ensure your title can be understood by researchers outside your specific discipline. Sometimes a cardiologist or maybe a nephrologist, for example, they may be searching your papers. So sometimes they need some reference or they some need some guidance regarding some paper. So you have to stick to classical terms which is understood by varied specialty people, and you have to stick to word limit. Important. Then comes the uh, highlighting the unique contribution, reflect the novelty or main contribution or study in the table. This helps to distinguish your paper from others in same field and attracts the interest of potential readers. For example, we published one paper during COVID, innovative use of UV rays and hydrogen peroxide for for sterilizing the mask which were used during the COVID period. So innovative use of hydrogen peroxide and the UV rays to sterilize the marks, an experience from a tertiary eye care center. So that was very eye catching and it has a huge reach. It had a huge reach. So, and balance creativity, clarity, make the title engaging enough to spark curiosity while ensuring that it is clear and informative. Avoid overlay clever or ambiguous phrasings and follow the guidelines. Suppose some guidelines want the title into be into a particular format or a particular style. For example, just now I just gave you an example of French Journal of Ophthalmology. They want the title in French also. So while you are submitting the paper, you have to write the title in English as well as French. So these are some journal guidelines. And very important, don't use any abbreviation. Sometimes the title becomes very big. Use of optical coherence tomography and for the importance of optical coherence tomography and fundus fluorescein angiography in patients of PPV or something like that. So these OCT, you tend to use OCT or FFA for that. So you should avoid that. So these are the like the abbreviations should be avoided because this you are starting the paper. You cannot use abbreviations may not be understood by everyone, although they may be a standard abbreviation. For example, visual outcomes and complication after phaco and a small incision manual cataract surgery in 2 eye hospital. So initially we had written 2 tertiary eye care hospitals in Nigeria, but they wanted in two eye hospitals. That was suggested by the reviewer that you just change 2 eye hospitals. So this sometimes the title is very big, it doesn't look very good. So the reviewer will suggest you to cut down it. Okay. Anti-infective therapy is a very simple title, but catching title. What is the focus of the study or the article is anti-infective therapies like the treatment strategies in pythium keratitis and navigating the challenges of infective critical analysis of treatment diagnostic approaches. So you can use continuity and without continuity also maybe a couple of phrases like this. And this is another example, a role of artificial intelligence, machine learning, deep learning, or corneal disorder, narrative review. So type of review has been mentioned in the title itself. So gives a good information about that article. So now coming to the introduction and methodology. The introduction is one of the important parts. You should know how to write an introduction. Every researcher or anyone who is trying to write the paper, because that forms gives a flow to the paper. Although methodology and results will be variable from paper to paper because of the heterogeneity, because of the type of study. But the introduction is a kind of literature which is already available, and you have to portray in a way that it should be appealing and it should be people should read it. So always begin with a broad overview of research topic. I'll just list few points here, then I'll tell you how I do it so that it becomes easy for people. So begin with a broad overview of the research topic, highlights its significance, relevance in the field. For example, ophthalmology, mention the clinical challenge or research gap in the study. Then define the problem statement, clearly articulate the problem you aim to solve or the question you want to answer, specify why the issue matters. and then establish the research gap, and then state the objectives and hypothesis. So what I always do, suppose we are writing on DSEC, or Descent stripping endothelial keratoblasty. So now if I am studying I'm writing a review article. So what I want, you have to think like what a reader wants or what you want the readers to read. For example, in a DSEC, everyone knows what is DSEC, but now this being a review paper or an article, you have to give the information about that topic, so that if suppose a postgraduate or a beginner reads it, he or she is also able to understand what is DSEC. So always start with a definition of what is DSEC, for example, then go into the epidemiology part. So a couple of lines on epidemiology, like the DSEC was started in this time period, then it prevalence in like this number of cases has been done, for example, like that, and then you just go on like uh, what are the what is the technique, kind of how we do it, what are the indications, then what are the clinical signs or the anti-segment findings in a DSEC, and then what are the complications maybe, and then what is the investigations are needed in a case, or what are the clinical judgment we need, and then comes the in the management in the end. And then you should come down to the aim of the article, like what is the aim, and what new thing you are trying to introduce, or what new thing you are trying to convey from this article. Because in the end, element of novelty has to come through that article, so as to get it easily published or accepted. Because if you write the same thing, nobody is going to accept it. You have to portray that our experience of DSEC in a tertiary eye care center from North India. For example, maybe you have 500 cases of DSEC, and people will be interested to know how and what are the results of DSEC from that particular center. So you have to introduce some kind of a novelty in that introduction. That's what is written here, like the establish the research gap and define the problem statement. Then describe the study design, whether the study is retrospective, prospective. Now coming to the methodology, this is we done for introduction. Now the methodology. So in the methodology, always start with the approval, like this study adheres to the tenets of Declaration of Helsinki. This line you have to cram it out, that you have to mention in the method starting in the starting, that this was a retrospective study done at a tertiary eye care center from this period to this period, and this number of cases were assessed. The study adhered to the Declaration of Helsinki, and IRB approval was sought. These are the starting three lines of any methodology for any study design or any studies. You have to have these three lines starting में, then only your study will go ahead. Your methodology seems good, and a good reviewer knows that you know the crux of it, how to mention or how to define a methodology. So here you have written specify whether the study is retrospective, prospective, randomized or observational, include the time frame and setting. So all these things have to be covered in first or two lines. Then inclusion exclusion criteria, very important. Clearly outline the criteria for selection and to ensure reproducibility. For example, age, range, diagnosis, like children above the 18 years were assessed for viral keratitis. Below that, we didn't assess, or the patients above 18 years of age were assessed for viral keratitis, and this was the inclusion criteria. Rest people were excluded, pregnant and lactating mothers were excluded, like that. So this is the inclusion and exclusion criteria. So usually the inclusion and exclusion criteria, you will get an example from previous papers. Go into the previous papers literature very nicely in the methodology. Usually these you can pick up easily, and you can even refine your inclusion and exclusion criteria based on the literature. Because if you read 10 papers, then you'll understand, oh, I missed that. Oh, I missed that. I have to take this into account. So inclusion and exclusion best is seen from the previous papers. Then explain data collection method. That is very important, exclusively important. How you have done the study, how the data was collected, such as diagnostic test, surgical technique, imaging, questionnaire. Any gap here, anything missing here will be easily picked up by an experienced candidate, and your paper becomes your paper is the strength of the paper lies here. Your paper becomes weak if you suppose you have assessed patients of keratoconus, but you have not seen the fundus, which is the routine part of examination. Because many patients can have VKC, and many patients can have steroid induced glaucoma, for example. So VKC and keratoconus go hand in hand, and many patients can have steroid induced. So even if you are assessing patients of keratoconus, but you have not seen the fundus, your study becomes weak, means your methodology is not sound. You have not assessed the patient correctly. So that's very, very important. The important part is how you have assessed the patient, what all diagnostic and imaging techniques you have included, and then comes the statistical analysis. You have to, before that, you have to mention the primary and secondary objective of the, like, primary objective is to assess the visual outcome, secondary objective is assess the maybe the astigmatism, or for example whatever it is, whatever is your secondary outcome. And specify the statistical analysis. Some journals want you to write it as a separate paragraph. Some journals want you to write it in the methodology itself. Below the methodology there is no separate heading, but there is a classical 4 or 5 lines of say statistical analysis that will be usually given by the statistician to you, or you may yourself write it, like which software was used and which like SPSS 21 point Windows software, and for continuous data, for variable data, what all things were used, like mean, mode, distribution, and all that. And then what all tests were used, Kruskal-Wallis or maybe chi-square test and all that. And if any special test has been used, that can also be mentioned. So statistical analysis is a routine part of a methodology. You have to complete it. You can't leave it. If you leave it and you have not defined it, means you again don't know the flow chart of a methodology, how the methodology you have to write in the paper. Important part about presenting the results is the most common mistake done by most of the people while writing results is they will keep on describing the results. Don't describe the results in the results. You have to just mention what findings you have got from the study, what results you have got from the study. Use a logical flow. Start with a summary of baseline demographic and clinical characteristics of your study participant. A result section should reflect numbers rather than language. That's very important. If numbers are missing, percentages are missing, p-values are missing, mean, mode, standard deviations are missing, means the method results have not been written or assessed properly. Then highlight the key finding. Focus on main outcome relevant to your study objective. For instance, in ophthalmic study, emphasize the visual outcome, intraocular pressure, complication rate. Don't keep on describing it. Mention the numbers. Again, I'm saying incorporate tables and figures. You have to include tables and figures. Another common mistake done by beginners or people with less experience is they'll put the figures and diagram just below the table, just below the result paragraph. Usually the tables and the figures come in the end, just after the conclusion. So don't mix up the figures and tables in the flow of the paper. You have to put it in the end, give a caption that table 1 highlights this, table 2 highlights this, figure 1 highlights that. So, and you don't have to put it in just below the paragraph of the results. Report statistical significant, clearly defined p-values, confidence interval, other statistical results that validate your findings. And separate primary and separate secondary outcomes. Start with the primary outcomes such as change in vision or refractive error, followed by secondary like quality of vision, quality of life, or patient's satisfaction. You compare it. If suppose there are two control groups or two groups, you have to compare the results of the two groups. The study involves groups, intervention versus control, highlight the difference of similarity between groups. Be objective, avoid interpreting the data here. Save explanation and implication for discussion. Very, very important, exclusively important. Don't describe, keep on describing the result. What is the inference from the result has to come in the discussion section. Most of them usually overlap. Some people overlap the discussion lines with the result section. Simply state what the results show. That's very important. And address outliers or unexpected results. Mention any unusual findings, indicate how they were analyzed or recorded. For example, you found out 5 patients of endophthalmitis in a microbial study. 2 patients underwent phthisis, 2 patients had this. So this has to be mentioned. So always, whenever you are mentioning the result, always put percentages in the bracket and all. This looks very sound and good. and keep the same thing logical flow. If you are mentioning numbers before and percentages in bracket, then whole paper will should show like that. Don't mix up somewhere like percentages are written before and then numbers, and somewhere numbers before, and that shows their casualness, that shows the inattentiveness. So you have to show that everything looks fairly good, everything is written nicely. Discussion and conclusion. Discussion, sometimes it becomes tricky to write, or sometimes it's difficult. You should know the way how to write a discussion. If you break the discussion into sub parts, so initially describe that what like, for example, start with the key finding. Begin the discussion by restricting the most important result of study, linking them back to your objective. So we did a study at this tertiary eye care center, and we found out that visual outcomes and complication after FICO MICs were this, and this is in consonance with the previous studies. Then you go on to compare your finding. Then next paragraph, you should compare your findings with the previous literature. And the literature should be within last 5 years. What are the most relevant 3, 4, 5 years, 3, 4, 5 papers in the previous years which have been published? Compare your findings to previous research in the field of ophthalmology, highlighting similarities, differences, or novel contribution. Here, you should always compare your paper with the other paper, highlighting the your findings or your results with that results. You have to mention the result. Don't say that our study show a statistical significance of p-value of this, and that study also showed that. This shows like you have just superficially went through the literature. You write that we had 15 complications in this and 10 complications of SICs of these in this group and that group. That study showed this number of complications and that complication. That is a classical comparison of your data with that data. Mention that data. Don't mention just that that paper also shows like that. Gurnani et al. Shows like that with that. No, you have to mention the findings. Then only show that you have done a decent literature review. Otherwise, you have just superficially read the paper. Address limitation. Then comes the important part that first is the key, start the key finding, then compare your finding with the previous paper. Then you should mention that what is the take home message from this article or your study. Then comes the limitation, then comes the strengths, and in the end, conclusion. So address limitation, acknowledge any limit. That is very important. If you don't mention any limitations in your article, this shows that your paper is too much perfect, which is not the case always. So okay, so always and always have to mention limitations of your study, such as sample size or any bias or any short follow-up, or sometimes you don't find any limitation, you just write then the study was a retrospective study. Prospective study scores over a retrospective study, for example, like that. And explain how your findings could impact the diagnosis, treatment on that is what the take home message of the article, how it is changing the practice pattern, or how it is changing the diagnosis or treatment, how it is useful to a clinician, how it can make difference at a place where people are accessing your article. Understand? So this is how your discussion should be a logical discussion. Then strengths I have not mentioned here. You have to mention the strengths of a study. Every study has some of the other strength. Okay. Then conclusion, summarize the key findings, provide a concise summary of a study overall outcome, focusing on relevance to clinical and academic ophthalmology. Avoid overgeneralization. Sometimes you write 10 lines of conclusion, which is not required. That becomes messy. Actually, the reviewer or the readers don't want to read a 10-line conclusion. Usually, the conclusion rests in 3 or 4 lines maximum, and that is very important. Ensure your conclusion are firmly based on data, avoiding claims that cannot be supported by your result. Very important. Your conclusion should be supported by your study and should not be saying which other studies say, or you are assuming it, or you are hypothetically putting something. And very important, future directions. You can always give a line in the end of the discussion, or maybe in the conclusion, that this study has a potential in future to be used like that or like that. It's highlighting the area for further investigation or emerging technology. For example, in Pythium, we are still not sure that antibacterial score over antifungal or antibacterials are the drug of choice, so still a gray area of research. So we can always say that this study was done on a small sample size. Still, a larger scale study with detailed analysis can be done, and this is the future direction. We can do a RCT or maybe a systematic meta analysis to give more detailed results. So always, if you give like this, then you show that my paper gives something, but still there is a huge scope of research in this particular field. So that shows that you're still claiming that like this topic is a still a researchable topic. And end with a take home message, conclude with strong memorable statement that encapsulates the significance of your study and contribution to the field. Suggestion for references, you should always general things I'll say, like always use peer reviewed journals. Go to the first and foremost is PubMed. I always use PubMed and Google Scholar and Scopus Web of Science, which is people very rarely use. Recognized textbook and credible online databases are there, but textbook hardly people have time now. Earlier, that was the time. This is a digital world. Very rarely you'll go through a textbook to find out the references. So always use PubMed first, then maybe Google Scholar, and then you can go into the other sources. You'll get more than enough references or citations from these sources. Journal guidelines very important. Every journal, usually journals from America, follow the AMA pattern, the American Medical Association, then American Physician or Psychiatric Association, something like the APA. Vancouver is that National Library of Medicine LLM format, which we usually use in our thesis, or maybe Indian papers. Most of the Indian papers, Indian journals have NLM or Vancouver format. Other format, there are nearly 10 formats which are usually on the, if you go into the PubMed, you'll find four format: APA, NLM, and this one MLA format, and one more format. But if you have to suppose this one Harvard style and other style, if you want, you can use the reference software, reference management software like Mendeley and Zotero, that are very good. And suppose you don't want to use them, you can just open a blank this one Word file. You can insert Mendeley citations there directly, and then copy and paste in your suppose in a particular format you want. Suppose you want in Harvard style, so you just go to the Mendeley, save the paper there, go and export the citation into your Word paper, and directly it will give you a citation in that format, and you can copy and paste in your article, or maybe you can use it in your article as well. But that needs a kind of a practice, and that needs a kind of basic minimum understanding of that software. So it will take some time to understand how to use this software. It's not that difficult, self-explanatory. There are multiple things on YouTube as well available, you can go through them. So use recent literature, very important. Previous 5 years, maximum 10 years. Don't go to very old papers, 1978, 1968. The data, the literature papers are there, but they are mostly outdated. Now, a lot of work has been done on that current literature. So use always 5 to 10 years. Sometimes reviewers go through the paper during the peer review, and they'll suggest that lot of references are very old. You should cut down them, or you can change them. Okay. And diversify sources, incorporate a mix of original articles, review system, very important. You should not use only case report. Suppose if there is a particular literature, for example, prostate branch angiitis, very few studies are there. You'll find mostly case reports. So you'll get the references mostly of case reports. So that becomes a limitation. Otherwise, that is very important. Use different sources like original research article reviews, systemic reviews, and all that. So automated citation management software, I told you, EndNote, Zotero, Mendeley for organizing referencing. Avoid overcitation. Focus on more relevant, impactful study. Too many references can dilute the message. Very important. Usually there is no limit to the number of references in a review article. Sometimes they'll say maximum of 100. In an original article, they'll say maximum 30 to 40. In a case report, they'll maximum, some Indian Journal of Case Reports, suppose they say 10, and a European journal will say 20. So different different journals, different guidelines. You have to go through them to understand how many references are required, and then you can plan your paper accordingly, and you can plan your references accordingly. Understand? And double check the accuracy, ensure that all references are corrected slightly, including author name, title, publication detail. It's not, this is a kind of work which cannot be done manually, so you have to just copy and paste. Most of them are usually correct, but sometimes some journals want it in a particular format, removing this, that. You have to sometime go into the minute intricate details of that. And emphasize the pivotal studies in your field to strengthen the credibility. Very important. Suppose you are writing some paper and you have missed the very important few important papers, that is not acceptable. So means that literature review remains incomplete. Suppose some paper is there and there is a suppose some topic is there and some very highly cited papers you have not quoted, then that becomes a problem. So you have to think, and you have to go through the literature correctly, that this topic, this reference has to come, like that. So how to reply to reviewer comments or rejection? This is very, very important, extremely important, because whenever your paper comes back after the review process, the chance of acceptance or decline totally depends on you, how you reply or how you manage. Because if somebody is sending you comments or revision, they want it revised, means they want it to accept it, they want it to get accepted. Otherwise they'll not send you. Means if the study has some potential or a paper has some potential, then only the reviewer will send the comments to you. So you have to be now very focused to reply in a correct manner, so that you get that paper through. So best practices for addressing comments are: stay professional, very respectful, very important. So always address the reviewer courteously, regardless of the tone or content of the feedback. Very, very important, because uh, you just have to feel like the reviewer is your examiner. If you are giving a viva, you feel like that you are giving a viva. So in a viva, if you say something weird and then you are there is a high chance that you are going to get fired. So here you feel like you are a student and he is your teacher, and is you're taking a viva. So always and always, yes sir, respected sir, thank you sir. You have to use these jargons correctly at correct places. So whatever comment has been given, so you just always start with respected reviewer. We totally agree with your comment, and then we have done this change and all that, like that. Acknowledge the suggestion, very important. You should always acknowledge what reviewer has suggested you. Thank the reviewer for the input, showing your appreciate their effort in improving your manuscript. Very important. Be clear and organized. Address each comment individually using a numbered or bullet format, ensuring that feedback is covered comprehensively. And provide justifications. For example, if he suggests something and you feel like, no, I don't do this in practice, he is suggesting something different. For example, just an example of a paper I gave you, I wrote, uh, we usually suggest surgery to OSSN patients, which is not very costly in India. But if you go to US or America, the surgery cost if the patient is very high, maybe 1 lakh or 2 lakh. One India, but you can do excision biopsy for 5,000 to 10,000 at a small center. So patients don't want to come to you again and again with the chemotherapy, because that will cost them, and that will cost them travel charges. Suppose patient comes to you for 5 6 times, every time he is spending 2,000 and 10,000 he has spent with 5 visits to you. Now, within that period, you could have done simple excision biopsy of a OSSN. So I wrote that at our center, we usually give the option of excision biopsy to the patient, and chemotherapy is costly to our patient, like that. But in US and other countries, that is reverse. For them, chemotherapy and medical therapy is less costly compared to a surgery. So now you have to give a justification that how the practices are done at your place and what are the charges. So in that way, if you don't agree with someone's comment, you have to explain it correctly, and you have to request them that please accept this because we do like this. Usually the reviewers are they will accept their comment, like that. So handling rejection and continuous feedback, analyze the feedback objectively, assess the comments for constructive insights to improve your manuscript, even a rejection. Sometimes what happens, the paper gets rejected, but the important comments given by the reviewers uplifts your paper, and that your paper becomes ready for next submission and has a huge chance to get through. Because that has been reviewed by expert people. So always you make a table. First is the serial number, the reviewer number. Then second column comes the comment by the reviewer. Third column comes the reply by the author, and fourth comment is the number. The fourth column you mention the changes made on the paper, changes made on the line number. So in that way you make a table, and then you have to submit, and you have to address each and every comment of the reviewer correctly and concisely and with respect, and accepting that somewhere you have not done some things right. And then you, whatever changes you make in the manuscript, highlight the changes in the manuscript in yellow, bold highlight, and then and you mention that this has been highlighted on this page number and this line number. So if some reviewer wants to go through your changes made, he can easily just see the line number and the page number, and easily it is visible to him that it chances of acceptance becomes easy. And respond to prioritize addressing key scientific or methodological concern as these impact acceptance. Sometimes there are pitfalls in the methodology or the results, then it becomes very difficult. If your methods and results have very much pitfall, too much of pitfall, then the chance of acceptance becomes less, because what happens, you cannot change the methodology now. Whatever study you have done now you cannot introduce. Or sometimes what happens, you have not analyzed you have not mentioned a certain parameter, but you have analyzed that parameter in your Excel, so that you can always introduce. But sometimes they say like you didn't do this, you didn't analyze this, then it becomes a problem. You can't go back and analyze everything again because you have not taken that data. So that's why the methodology and results become very important. So if the important things are missing there, chance of rejections become very high. Revisit and revise your work. So before submission also, 2-3 times you should go through your manuscript for revision, any pitfalls, any problems, and even before resubmission, ensure that aligns with reviewer's expectations. Usually, yeah, the chance of acceptance is usually 60 to 70% if you say. Like if you have addressed everything correctly, the chance of acceptance 70 to 80. Very rarely the manuscript gets rejected. Consider alternative journals. If rejected, explore other journals more aligned with your study scope, significant, tailoring your submissions according. Always keep in mind a list of journals. Suppose if this doesn't go through this, then I'll go through this, and all like that. And very important thing is, you have submitted your article to a journal with an impact factor of 5 or 6, or maybe like suppose you have submitted to impact factor of 1 or 2, and it gets rejected. Now there is no point in submitting to a 3 or 4 impact factor journal, because your article is you'll not accepted by a journal with lesser impact factor. So going to a higher impact factor is very difficult, because they don't feel like that the study has this much of strength to get accepted here. How to become a good reviewer? Practice that makes you perfect, and going through multiple papers, spending times with the paper. In-depth subject, a very important attribute of a good reviewer is knowledge of the subject. A good reviewer must have a thorough understanding of subject to provide constructive feedback. That's why it becomes very important during the PG time. You should study your subject very well, so that the concepts and the basics should be thorough. Everything should be well aligned, because you don't know which specialty you'll focus more in future. So very important aspect of during PG time is you should study everything very in depth and thoroughly, so that that becomes a core of your publications, or being a reviewer in future. You have that good knowledge to give scientific feedback to any paper. Commitment to objectivity, ensure unbiased and fair evaluation. Very important. A reviewer should be unbiased, it should be fair. Sometimes what happened during a single blind review, many times you'll see the author's name mentioned in the paper, and that will be exposed to the reviewer. Sometimes the reviewers they become biased because they may know some of these authors. So you should not do that. Focus solely on the quality, validity of research, regardless of author's affiliation, reputation. Very important. Effective communication skill, deliver feedback in a concise, clear, and respectful tone, avoiding overly critical way. You should not criticize the paper too much. You should always appreciate the paper, I would say, and always say that this could have been done, this could have been, this was missing. this was not done. You should not say, no, this is very bad study, this was not done, like that. So you can express a lot of things with the tone you speak or with the tone you mention. So always that is very important. The shortcomings should not be mentioned in a too much of negativity. The shortcomings should be mentioned with less of negativity, and the strength of the paper should be highlighted, so that research carries forwards. That should be the aim of a reviewer, to invite more research in that particular field. Timeliness, adhere to the review deadline. Because if you suppose you are a reviewer, and if you are reviewing too many articles, you'll know that this journal wants me to review this article in 10 days, which may not be possible, and you may have a commitment on that day or of 10 days. You may always request them, like, I need 2 weeks more, I need 5 days more. They will always give you. So adhering to the timely feedback is very important for authors and journal editor to maintain publication schedule. Or sometimes you can ask them more, they will give you, thinking that you are a particular expert in that field. And follow guidelines. The journals usually have a author reviewer feedback form. So you have to you have to fill the feedback form. You have to follow the guidelines given by a particular journal. As you become a reviewer, you go through them. You will get to know all these things. Focus on constructive highlight strengthen strengths while identifying areas for improvement, offering actionable suggestion for revision. Stay updated in advance. Is very important aspect of a reviewer is getting updated about the current literature. Suppose you are not updating yourself, then what happens? You don't tend to give very much informative reviews. Like suppose something is missing, some new device has come up, or some new technology has come up. What has been done in AI? What is Chat GPT? How are more deep learning models are being utilized for a microbial keratitis? So you have to keep on updating yourself. How you can keep updating yourself? Go to Google Scholar Citation, make a profile there, and you can always there is an option that you can put some few keywords. For example, you want cornea and cataract research articles, then you have to put your email ID. So whatever cornea and cataract research articles will be published there within that week will directly come onto your mail from Google Scholar. So you'll keep on, suppose sometimes you are just scrolling your mail ID, you can always go through them. So this will help you to keep in updated. Suppose some new paper has come, that will the Google Scholar mail ID will give you that article in your mail. So you can always go through that. Okay. And maintain confidentiality, because as a reviewer, still the paper is not published. So you don't share any aspect of that manuscript or the concept or the findings, like that. And one thing which I have missed is about a reviewer is, if you want to become a reviewer for a journal, before that, most of the journals will ask you to fill in a particular form on their website, and they will ask you to give 5 PubMed index publications. So you should have at least 5 PubMed index publications to become a reviewer in a good journal. Most of the journals will ask you, if you give them, then only they will start inviting you, feeling that you have done a considerable amount of work in that field, so that we feel that you can review this paper, you can become a reviewer. Practical tips for using guidelines for equator while writing various papers. Importance of equator guidelines is that ensure standardization. Adhering to these guidelines, like consort for trials or prisma for systematic reviews, ensure standardizing reporting format, enhancing manuscript clarity and transparency. If you adhere to these guidelines, then the reviewer or the journal editor knows that you have been through a correct pathway or correct guideline, and then the chance likelihood of rejection becomes less. That improves the quality and rigor. Following these guidelines helps ensure that the study meets the international standards. So that becomes very important, because in the end, they are eyeing citations from that article or the reads from that article. So scientific accuracy, methodological rigor should meet the standard, international standard to us. So this is a flow chart. If you go onto the Google, you can find there. So this is a equator reporting decision tree, which guidelines are relevant to my work. So Moose, Prisma, Consort guidelines arrive. So every particular article has a particular kind of a guideline. You can always go through them. Usually, what happens if you go in a correct pattern, you will follow these guidelines indirectly. You don't have to go through them like I am following Prisma guideline. But knowing them helps you. For example, Prisma uh, and Moose. If you know them, then definitely the chances of rejection or query becomes less. Well structured, facilitating peer review. A well structured manuscript is easier for reviewers to evaluate, improving the likelihood of favorable feedback and acceptance. That's what, if you follow the guidelines correctly, Equator guidelines, then your chance of acceptance become very high. Boosting research impact. Equator compliant papers are more likely to be cited. As I already told, they provide comprehensive and reliable information from other sources. And identify the relevant guidelines early, determine the appropriate equator guideline for your study type outside of study. Usually they are given on the Google, and sometimes the if you go to the author information sheet in the journal website, they'll mention that you have to follow these guidelines for this kind of a paper. So you can always go through them, and you can jot down, and you can make a list of them so that your paper aligns with that or not. Integrated checklist items in your manuscript draft to ensure all required elements are included. Usually, very few people do it, but you can always do it. Sometimes some journals want you to submit this checklist that you have done it. They will have a form on that website. You can download that form. You can analyze your study that all framework have been, all the checklist items are there or not. If something is missing, then you can you can always give a query, like you can always give a feedback that why this is missing. Consult example review, publish article that adhere to the same guideline for insights into effective. For example, survey of ophthalmology. If you go through the journal, highly cited, impacted for only for review articles. So these review articles will follow all these guidelines. So that's why if you go to any article 5 years down the line, they'll have 300 citations, 400 citations. That's why the citations become important if the impact factors journal is high, because these journals follow the correct guidelines, and only that paper go through once the guidelines have been followed. And very important to seek assistance, engage colleagues or professional editor familiar with Equator guidelines to review your manuscript before submission. Practical tips for writing a review article is very important. Make a outline first. Make a outline that what are you going to include in your article. Define the scope correctly, like define the specific topic, objective, audience for review. Avoid overly broad themes to maintain focus. Conduct a comprehensive literature review. Very important aspect of a review article is literature review. That is very important. Literature review has to be. You have to mention that.
After this mistake, later on about 9:40, the hero Allu Arjun and his family and personal security went to scene, entered into the theater premises. On seeing him, all of a sudden, crowd started approach towards A11. Security personnel 12 to 15 and others at A11 pushed them away forcefully, due to which mob entered into the lower balcony of Sandhya 70. As a result, a heavy rush and a lifting and was supported. So
Yeah.
Hospital
eventually, because I have gone to the theater thousands of times, I can't speak from a personal experience. People, when someone is going into one balcony, people don't go into the lower floor. What really happened in leadership seems to be police were intimated, police were present. They are not in adequate numbers.
Should I go ahead now? Should I go ahead now, sir?
Sir, please go ahead, sir.
Yeah. Now it's muted. I think Madhu had
So,
unmuted. Yeah.
So very important aspect of a review article is comprehensive literature review. So before writing it, you should go into the PubMed, Scopus or Google Scholar, download all the relevant articles, or maybe just keep in a list of like maybe 15, 20 articles, relevant 30 articles, then understand. And important thing is before writing them, you should always go through these review articles also. Whichever previous review article published in on that topic, should go through them to understand that how that review article has been defined, or how that has been written, what all new thing you can introduce, what all things are missing, and what all new literature you can introduce. For example, a review article written in 2023, now you are writing in 2024. Within that stipulated time period, more number of articles must have come, or new literature must have come. You should introduce that literature in your review article to make it slightly different, or make it novel, that these papers were not previously studied or like that. Then organize the structure. Arrange your review article logically. Section like introduction, methodology, key finding, discussion, conclusion, literature search. Then, for example, we are writing on, we are writing on DSEC, for example. Then describe the technique of DSEC. Then you describe the indication, describe the complications, describe the innovations, then describe the future directions. Then also this is the kind of a pattern you should follow. And important thing is, you should stick to the word limit. For example, Indian journal have 5,000 words word limit. Some other journals will allow you 9,000, 10,000. Some will say there is no word limit. So this is kind of a thing like that. You have to follow this approach. Highlight gaps, controversies, advancement in the way, appreciate, add your perspective rather than simply summarizing study. Very important. You should always also mention your experience in a particular. For example, we do this at our center. We follow these guidelines. This is our experience. This shows that you have the basic. You have put the basic information. Then you have put the information through the relevant literature studies, and then in the end you are adding your experience. So that makes it holistically a very good review article. And write a compelling introduction, explain the significance topic, state your objective, outline the organizational review, summarize tables, figures. Very important aspect of review article is good tables. 2 3 tables, sound tables of literature review, few figures. Maybe suppose if a particular surgical technique we are following, then give few important clinical pictures of that particular surgical technique. And you may also give a flow chart of Prisma or consort guidelines. Or maybe you can also give a a figure of the literature search. Like suppose 10,000 articles were searched, and then duplicates were removed, and in the end we shortlisted 762 articles, excluding case reports, small editorials and all that. In the end we came down to 42 relevant articles of our study. So in this way you can always give a flow chart, and you can say based on what criteria you excluded the articles and all. How this we can do it? Going through the previous papers, they'll give you more experience in understanding this. Maintain a balanced perspective, acknowledge limitations, study reviewed and avoid biased interpretations, and adhere to guidelines. Follow the target journal format. Citation style, very important. Reference citation style has to be correct, and reference has to be as whether they need in brackets or full brackets or close brackets, or they need in superscript, subscript, how they want. You have to go through them, and proofread thoroughly for clarity, coherence, and grammar accurately. Important thing is, don't do grammatical mistake. As more content we are trying to write, the chance of grammar mistake and small mistake, comma, full stops, spelling mistakes become very high. So I'll just rest my discussion here. Thank you so much.
No,
Hope it was very informative.
no, very excellently you have covered all the corners of the topics, and very nicely you have covered. Only thing is, the student has to go through every point carefully again and again, explore and learn about it. And there are few things which I want the other people. Ashok is there, and let him give his feedback, and also any other clarification he wants to clarify. Dr. Ashok.
Thank you, Bharat. I think it was an excellent talk. I think covering so much of information in 1 hour is a big task, and I think you have covered all the important points.
Thank you.
right from writing a paper, reviewing it, and then writing a review article. I think it's a very great job which you have done. Just one or two points which I thought I'll add is in the introduction, I think, as you said, the review of literature is very important. And what specifically are we going to look in the study, which we are doing? Because already there is review of literature, there's so much of findings. But in this study, we want to emphasize at the end what specifically we are going to look in this study. I think that mostly that comes from the discussions of the previous literature. I think once we read the discussions of the previous papers, and I think each discussions will have some limitations or something that they want to study in the future. I think those things will give you an idea of choosing what you have to newly study in the study which you want to do. So I think that can be highlighted at the introduction part or towards the end. And methodology, as you said, I think in any study, I think methodology is the key. I think any paper will be evaluated by the methods that were followed in doing the study without any bias and those things. And being clear with the methods, like clinical method, I think they just casual, like IOP was checked. But IOP was checked how? Was it checked with applanation in CT or something? Applanation was it checked once or thrice? Or was it at different times checking a BP? So similarly, I think in the methods they have to be very precise of how each and every data were collected. And having a concert flowchart, I think, will give a clear picture. I think so many patients were totally studied in that study period, and so many met the inclusion criteria, so many included in the exclusion criteria, and how many were followed up and how many lost for follow-up. So if the whole chart flow chart is shown, I think the whoever reads the paper can know what really happened in the study, rather than just saying 75 subjects were recruited. How were they recruited, in what time duration, whether consecutive patients were recruited or like randomly they were chosen. So I think methodology part has to be very rigorous, and it also has to be written very clearly of how it was done. So that's the results. I think, methods. Results, as I said, I think studying the previous papers, I think will give an idea of what kind of tables and figures which we want to put in our paper. I think the headings and those things will be almost kind of a similar thing, which we can know from different study papers, what tables and figures which we want to do. As Bharat rightly mentioned, I think we need not repeat the same things what is given in the tables as well as in the results. What is in the table need not be repeated again in the figure. So we have to balance it. And I think discussion part you have covered excellently. And discussion part also has a chance for bias, like a citation bias. So discussion is the area where the author has the knack of leading the way he wants to take the discussion to. So with the results, he tries to tell something that he thinks it's true, or he wants that to be done by the other people. I think so we have to write the discussion part in an unbiased way, citing all the reasonable journals that have been published before. And
yeah, sometimes what happens is our results are matching to some study, then you have to quote them. Sometimes they are going away from our studies. Some study is quoting something totally different, and our study is quoting something. Then you bring that study also into the play. So saying that why this has happened, and also that makes it more interesting and more mixed point of view of different, and the reader will also like it that nicely covered. So the most relevant papers with heterogeneity will give more informative information in a discussion. That's what I feel. Sometimes the results match to some study very closely. Sometimes they are totally away. Some studies from a Singapore or a China is totally giving something else. So this is how it becomes very important.
yeah, true, absolutely. I think whether the results of gets along with the previous results or it's totally different. So what you feel maybe the different reasons for it to be the same or different. I think so based on the methodology or different ethnicity study, I mean surgeons who did the surgery. I think those things can be discussed on the side. And I think I learned so much from how to review an article. So I think it is good to hear how to really review an article. I mean, I reviewed few, not much, but I think it's a good thing to learn to be more tell more positive things about any paper somebody publishes. I think that really will encourage people to do
I
more
when
research
I
also.
reviewed a
Yeah.
lot of papers, I learned a lot of things from them. Reviewing helps you to understand the thought process of the other authors, what they
Yeah.
are thinking, or how they can define that particular aspect away from you or very well from you. So reviewing is a like voluntary work, doesn't give you anything, but it gives you logical thinking that this can be portrayed like this, or the results can be put like of this. Like for example, one of two case reports I published, they've got published because of the timeline. I saw one of the Chinese paper and they had given such a nice timeline of every visit, how the patient fared up. So I just had tried like I'll also put, and it got accepted. So this helps you to understand, like the review helps you to like understand the thinking of other people, like how they are better or what they are doing better to do is. So that's how it helps, what I believe.
True,
That
true, true.
improves
Absolutely.
your paper to an extent, lot of extent. You because you review, you know this is wrong, this is right, and then you don't introduce that error in your paper, and the chance of acceptance becomes very high when you are writing it. So then as soon as you review more and more, you learn more and more, and your error becomes very less. The those whosoever is reviewing your paper in future will know this is a very smart author, he knows everything. Then I don't have anything to say, I have to accept it. So this is how the paper acceptance become high, by reviewing your other people papers.
True, true.
Ex-
Absolutely. Yeah.
Excellent input from the Ashok, and now I request Professor Bharan Kumar Reddy to give his inputs. Bharan Kumar sir, you are online. Hello, he is there. Unmute yourself. Bharan Kumar garu. Anyway, I have two or three doubts. One thing is, sometimes the reviewers give comment, because as an editor, when I was seeing, the author will not give much good reply, but the same thing he submits again. That is very irritating. And
Yeah.
yeah, what to do in that situation? Very difficult to convince the both.
Now, if like suppose a reviewer has given 10 comments, and you feel like while revision the authors have not given two, three answers correct, but rest have been nicely done. So now you have to see that whether this paper is really good or not. Then, if you want to really accept it, then you can again send it for with the comments that this has not been highlighted, or this has not been replied properly. If there is a possibility reply, then the chance of acceptance become high. Then the author feel like, yeah, the reviewer is particularly pointing out. This has happened with us couple of times, three, four times it has happened.
Yeah.
One of the reviewers have not got satisfied with our comments. He has again sent it. One paper got rejected also like that. One of the reviewers were not happy, and that got rejected.
It looks very adamant,
Yeah,
sometimes
yeah. Sometimes the reviewers are very adamant that they want it in that format, but it's not possible because the study has been done, the results have been analyzed. How can we change the whole paper? It's not possible. So
yeah.
sometimes the reviewer has to be logical also, saying that whether this is a possibility in author's domain or not. We should be as a reviewer, we should be skeptical in that whether what we are asking to a author is correct or not. Also, sometimes they ask vague things, and which is not possible. And initially, sometime what happens, they ask you to change something, you change, but they don't like it, and they say you didn't do it, but you have done it. So that becomes a mismatch. So this is totally luck based sometimes. So if you feel like the paper is very good and you want to accept it, you can send it again for a revision. Sometimes the
And
paper comes for 4 or 5 revisions, and then it got accepted because they wanted to uplift the standard of that paper to that extent.
fine. Another thing is, some of the reviewers, they bluntly say they reject, but that is something which is very, very bad. I feel there should be some reason
Yeah.
why they are rejecting. And they
That
won't
is,
give that. Then what to do in that situation? It's very difficult to change the reviewer.
so this is where the bias comes in. If the suppose some author knows, if the some reviewer knows the author, and then bias comes in, they reject it without any reason. Some what happens? One example I gave you. We submitted one paper on orbital cellulitis with ROP, and the associate editor in one of the reputed journals, he didn't read it. He didn't go through the paper, blindly rejected. But that was a very good. That was the first case report in the world. So I was very annoyed, like why this got rejected without any review, without any good
Comment.
comments.
Yeah.
Then I mailed the editor, sir, please have a look. This is one of the first case reports in the world, and I feel it deserves a good peer review. The editor went through the paper. He accepted it next day. Can you imagine? So it happens. That was in European journal. So sometimes you feel the content is good. You are on the right path. You have done all the hard work. Your literature reviews sound everything. You know you have done that. You can always request the editor. One
Yeah.
time, what happened? I replied to a paper, and I wrote a letter. He thought I wrote a paper. He rejected it. Then I
Yeah.
told him it's a letter, it's not a paper. The editor has not, associate editor.
Yeah, Barun Kumar sir have come. Yeah, 1 minute, 1 minute. Professor Barun Kumar has joined, and sir, please give your feedback.
Hello,
Yeah,
am I
please.
audible?
Yeah, audible. You can.
Yes, sir. See, one of the things which we mention is the ethical acceptance. Is there any difference between the legality, morality, and the ethicality?
You repeat again, sir.
See, one of the things we mention is, especially papers from institutions, we have to make it that we have accept ethical committee approval is there.
I know.
Yes, but what exactly mean by ethicality?
Sir, ethical approval means that earlier what used to happen, like most of the journals, they will post a prospective or a retrospective study, or maybe RCT. For RCT and prospective study, they definitely need approval. But for a retrospective study, sometimes they'll overlook. But now this has come into guideline that for any study that should be registered on Clinical Trial Registry of India, and you have to give a number, then only the submission will process. So that is the ethical aspect of it. Sometimes there is no IRB committee in a particular area, but the author submit a paper saying that IRB approval was obtained. Then comes the issue of ethicality and legality, whether this was really done legally or not. Because any intervention on any critical, there is a lot of echo of the sound in it. Hello?
Anything more, sir, from Barun Kumar, sir? Anything more you
See,
want to
one
ask?
of the reasons for rejection of a paper is ultimately the sampling size. Is there any simple rule of thumb wherein suppose we'll have a good paper, we thought of a good presentation especially, but regarding the sampling size, once we go to the SPM people, your sample is not adequate like that. Is there any simple rule of thumb so that in the beginning itself we know how to select the sample size?
Sir, this was we discussed in the previous webinar that sample size is usually governed by the studies which are already been published in the literature, and depends on the prevalence and the incidence of a particular thing in that area. For example, if we are studying viral keratitis, which has been really studied very well in the literature, and if you go through the previous papers and they're showing like one of the studies studied 500 sample, one studied 300 sample, one studied 400 sample. But now in now you are just taking a sample of maybe 50 or 100, then the paper strength becomes weak. So what usually is done by a statistician, if you send a paper for a sample size calculation to a statistician, he'll ask you to give me 5 relevant papers, recent papers with the highest sample size. Then he'll go he'll judge on based some statistical parameters. They'll judge and they'll find out the sample size based on the sample size formula, and they will ask you to the time frame study. Like maybe they'll just give you a sample of maybe 500 or 600, and then they'll you do a study of 2 years for 500 sample size like that. Then you have to judge whether you are able to do that in that particular period or not. For example, my thesis had sample size of 138 in 2 years, but I got only 95 patients. That is fairly okay, but not a problem. So they'll give you a time frame and they'll give you a sample size. Whether you are able to complete that sample in that particular time frame or not, that is a secondary thing. But that study needs this much of sample size to become a good study. So that is usually given by the statistician. So we should be in touch with a very good statistician, send him most relevant papers, recent papers with good sample size and some landmark study. He'll calculate and give you the sample size. So this what happens if we calculate a sample size on our own, like we want to study in 6 months this number of patients, then that becomes a problem. So you should get a sample size from the statistician saying that your study aligns with the previous studies, and your study has a potential, like they'll give you 400 500 sample size, then it becomes easy. Then nobody can query you. Suppose 500 patient data have already been published, you are sharing a data of 600 patients, your paper has a good strength to get accepted.
Thank you. Learned a lot from your presentation. Thank you.
Thank you, sir. Thank you. Last one, Bharat. I would like to say the entire exercise from the APOS to conduct this one is to help the postgraduates in learning the art of research methodology. And would you mind in giving your email ID or the YouTube presentation so that our postgraduates can access you? Is it possible, or shall I put it or not put it?
Yes, sir, definitely. Why not?
Because some of these queries very difficult to answer. Sometimes they may share with you on not a telephone, but only by mail, so that you can see the data. You can see the data what they are doing. You can give some suggestion. Maybe they get benefited.
Yes, sir. Yes, sir,
Thank
definitely. It will be a good learning experience for me as well.
I know. Thank you very much. Samira, madam. Yeah, can you propose a vote of thanks? Just say
Yes, sir.
Yeah.
A very excellent presentation, sir, as usual. And you have started from very beginners. For beginners also, it is very good that how to write an article, how to look into the main points, everything. As usual, yours is a very excellent presentation. And the quote says that practice makes us perfect. I request all postgraduates to kindly go through this and try to make useful of your presentations. Excellent presentation as usual, sir. Thank you so much for this.
And I also thank the Ashok sir and as well as the Bharani Kumar sir for coming to the online and giving the everyone feedback. Thank you very much. Shall we leave, sir? Bharatji, you want to say any word?
I want to thank Madhu sir also for.
He is busy. I think he is not there.
He is not there.
He has come, but I think he has left. Yeah, because Gopal sir has to go to Delhi. Some other. Yeah, that's why. Okay.
Thank
So
you, sir.
thank you very much for your kind feedback. And anything is there, I'll come back to you. And I need some of your help on a one or two topics anytime. One topic we'll cover it. So we'll give you sufficient time so that I'll ask the postgraduates and what they want. On that basis, we will cut. Okay. Thank you very much. Thank you.
Thank you, Bharat. Thank you, everyone.
Thank you, Ashok sir.
Thank you, Murthy sir, for taking this initiative.
Very important.
Very important. Yeah, thank you.
Yeah, we're going to keep this everything in our website so that our postgraduates can access. And I also give his email ID so that they also can send their data and they want to have some queries, they can get it cleared. Very important. Thank you very much, sir.
Thank you.
Thank you.